endoscopes, and suction with urethral access sheath. These are my declarations, videos, images consented for the patients. First of all, what are the objectives of this meeting and webinar? Is the urethral access sheath suction, we call it fans, and the small endoscope. Let's go for the first part. We know that urethral access sheath, the standard one, came to relieve the kidney from the high pressure. It's been studied and it's been proved by many publications that urethral access sheath could help you and surely helps you to reduce the intrarenal pressure. And we discovered with this urethral access sheath that if you have a dusting laser and small fragments and you have a space between this access sheet and the scope, you have not only reduced the pressure, you could have more stone free. That's why in the beginning of the early 2010, 11, sorry, 2020, 21, started to have the standard access sheet. They added a section, as you could see here. But the idea came, why not we do it as we expected, the bendable one. So what is important point? What are the important points of the flexible urethral access sheet? Is that the availability of the dusting laser, the MOSIS in 2018, and now the TFL. Moreover, we have the thulium YAG pulsed mode. And we will discuss the design of this access sheet, and we will discuss how we deflect this access sheet inside the kidney. So the first point, that the dusting laser came into the market and help us to have more dust instead of fragments. We know all of us as endourologists, we have this problem of fragmentations and we basket them. Now we have this dust, and for the blurring vision and this dust, we ask ourselves why we cannot remove them by suction instead of basketing. That's why you have to have a less than 250 micron millimeter. Imagine that your laser fiber is a 200 micron or 270. It means you have a fragment about 200, 250, which is necessary, important to aspirate what is inside the kidney to make the patient more stone free. So we became more obsessed with the idea of stone free. Now, the first generation of the bendable urethral access sheet has two problems. The tip of the access sheet was not more, we call it floppy, so it's like a little bit traumatic. The second, and the deflection of that urethral access sheet was a little bit difficult, and that caused the problem of deflection of the ureteroscope and cause breakage and damage of our ureteroscope. Now, the second generation came with the floppy tip and more soft tip. If you could see, this is the other part of the design, which is very important, that as long you manipulate the urethral access sheet, before you put an access sheet, Majed, do you remember that? You put an access sheet and you work with uroscope. Now you have to work with your urethral access sheet. So it means you have a lot of manipulation inside the junction, the ureter. You turn it right, you turn it left, you put in, out, because you put it to the upper calyx, we came down to the lower calyx. It is very important to have an access sheet bendable with a good rich hydrophilic coating. Otherwise, it might cause a problem, especially with the virgin ureter or tight ureter. You saw that you are watching now a design of Innovex, where you have the tip hydrophilic and a very rich hydrophilic coating. Now, what is else available in the access sheet with suction and bendable? These are, we call it valve. It control pressure. If you close it completely, it's like an open surgery. If you close it completely, it will give you more pressure, more suction and aspiration. And you can connect it, as you can see in the left side, that you can connect it to the collector. It looks like a PCNL with a stone catcher when we're using when we use the thing from for the PCNL. Imagine, do you remember this shock pulse and trilogy, right? You are with me, right?
Yes, yes, Dr. Saeed.
So you can see here that the access sheet connected, then the suction connected, goes to that stone catcher. Look how beautiful we are collecting the stones. So it's like a very unique design of the access sheet, bendable, like a fans. Now, what is important
Dr.
with
Saeed,
Innovex? Yes,
if you allow me, just I want to tell the audience that we have a question and answer space. If they wants to drop any question, so they have to drop it. Then after we can discuss it with Dr. Saeed later. Okay, just to tell the audience these things. Go on, Dr. Saeed.
thank you, Majid. Now you know that the Innovex has a very unique apart from the other access sheet available in the market. They have the inner part. They have maybe 6 type of the access sheet with suction. Now I was surprised with the new edition of Innovex. They have the inner part rich of hydrophilic and measurements. You can calibrate the ureter if you have. You can use it as a calibration of the ureter. You can tell what is the size and the length of the access sheet. For example, if we have a woman in Saudi Arabia or the Middle East, you can use an access sheet between 40 to 45. Unfortunately, some companies they provide you only with 40 and 50. So I say always calibrate the ureter and see the size, because you need that access sheet to go inside the kidney. If you use a guy with 180 centimeter, use him an access sheet 40 centimeter, it will stop in the upper ureter. You will barely reach to the kidney. This is the idea here. Now I am saying in the Middle East, for a male you need to have a 50 to 55 access sheet with suction. In the female, from 40 to 45. And
I
the
think, Dr.
45
Saeed,
and 50, yes,
this is smart step and innovation of urethral access sheath, because one of the dilemma
true,
of urethral access sheath, where can
true.
we stop? Where can we stop? And the shortage, different sizes of the urethral access sheath. This is smart steps for
Yes,
this innovation.
true.
Yeah,
True. That's the point here. That innovation, we have to look for the details, and the details will never be looked out except by the KOL who's practicing more and more, and to find out where are the things that might help the other urologists or the normal urologists. Now, what is important for the deflection is the soft tip. We have the 10 centimeter always, because we know that the uteroscopy is having 6 centimeter at the tip. So the access sheet with with fans with the flexible tip, it should be 10 centimeter. And you can see clearly here how soft the tip and rigid in the same time, and could be deflected easily with the ureteroscope. Now, look at this situation. We have an 8.7 and we have an access sheet 1012. You can see how beautiful the deflection of the usual access sheet. Now, the first generation was not enough soft. The second generation it became soft to make you happy and to bring you to the lower calyx. And look at these stones. They go out without basketing. You just suction them. and and this is very important to know how important these details is for urologists. Now we come to the second part, which is the small endoscope. We know that 9 French is away from the market. We know that the only thing keep 9 French in
great.
the market.
There is
Yes.
one question from one audience
Yeah.
about the setting of suction. What's your setting in suction?
That's a very clever question. Now we don't know. It's up to the COL. But with what we discovered, that the uteral access sheath, you should go between 25 bar to 200 bar. Sometimes if you have a small access sheet, 10 to 12, you can go up to 200. But if you have an access sheet very wide, 12, 14, you have to go up to 300, because once you have a wider access sheet and wider space, you need more pressure to up. It's like the pie when you suck from a juice. If you have a big pie, you need more force to aspirate. And we don't know. That's why many companies came to the regulate the suction and the pressure and the flow. We need a machine that it causes the flow and the suction and the pressure in the same time. It depends on the surgeon. But I believe what I'm practicing, when I start dusting, I put 25, 50. When I want to remove this fragment, I go between 100 to 200.
Thank you, Dr. Said. Just please, audience, ask in the site of question and answer, not in chat, please. So we can be on the on the same plate. Go on, Dr. Saeed. Thank you.
So that's what was about the urethral access sheath. Any question?